when you have a cancer diagnosis, you're just thrown into a whole new world that you never expected that you would ever have to go through, especially for young women that are sort of at their prime. They're starting their jobs, they're moms, they're figuring out life and relationships, and then all of a sudden you're thrown down this loophole where it's like, actually, we're going to sidetrack you way over here and try to, you can find your way back.
Hello, I'm Eric Anderson. The voice you just heard belongs to Kim Swatecki, and she is one of the many voices you will hear in episode 12, part 1 of YXC Underground. Say the word cancer, and each of you will have something different come to mind. It might involve a loved one who had cancer, or perhaps is going through treatments right now. It could be the memory of someone close to you who lost their battle with the disease. I know for myself, I think of my Uncle Cam, who passed away rather suddenly 14 years ago from a type of cancer called mesothelioma. Say the word cancer in the context of a podcast, and it opens up a world of storytelling possibilities. Some of those stories are uplifting, others are courageous, even if they might not end the way we want them to. For the next 2 episodes, we are going to introduce a wide range of people in Saskatoon who have connections with cancer. Our focus will be on people who are helping those in Saskatoon either undergoing treatments for cancer or post-treatment stages of their battles. You'll notice I said we. That was on purpose because I have a very special guest who will be co-hosting the next 2 episodes, and that would be my friend Amy Smith Morris. And we're actually in Amy's backyard on a Friday morning, and she's sitting right beside me. Hi, Amy.
Hey, Eric. How are you?
I'm doing very well, thank you. Thank you for this, and we'll get more into this later on in the podcast, but none of this would be possible without you, so thank you.
Oh, I don't know if I can take much credit, but you're welcome.
Well, I'm giving you all the credit because so many of the people that you're going to hear in this podcast come through connections with you and your own story. And so the funny thing is, we've known each other for quite some time, and you're too darn popular and well known to be a guest on YXC Underground because you're too above ground. But it's been great working with you the last few months, getting these episodes assembled. And I want you to share your story in terms of how you became involved with all things cancer.
Mm-hmm. Yeah, so I agree. I am too. I'm not underground at all. I'm very above ground. And that was not something I always thought I was going to be doing when it came to my story of cancer and how I fought cancer. So really, for me to tell my story, I have to go back to the beginning. So it was 2016, and my husband and I had both just finished our doctorates. So I have a doctorate in oncology pharmacy, and my husband has a doctorate in nutrition. So we're very healthy people. I was just about to turn 30. We're both competitive strength athletes, both been on Team Canada. So needless to say, there is not a lot of junk food in our house, and we are very aware of our bodies. So we were getting ready to get married in September, and we did. We had a lovely wedding in Saskatoon, and shortly after we went on a honeymoon to Italy and Greece. And we did what I think everyone should do when they travel to Italy and Greece, is we ate our way through the countries. So pizza and ice cream and cheese. I'm getting really hungry even just thinking about this. And when I came home, needless to say, I'd gained a little bit of weight. Go figure. So what I noticed, though, is after a couple weeks of getting back to our routine, I wasn't losing that weight. I was actually maybe even gaining another pound or 2. And the only other symptom I had, and I mean the only other symptom, was heartburn. I had heartburn all the time, acid reflux, every day. I was constantly chewing on Tums. So I went to the doctor. And it didn't take long to realize that I had a tumor on my ovary the size of a football. So 21 centimeters by 10 centimeters. And that's kind of when I found out that I had ovarian cancer at the age of 30. So I underwent surgery to remove that tumor and my left ovary, 35 staples, the longest incision you can imagine across your abdomen, followed by 4 cycles of chemo, and then the long recovery that came after that.
I had the privilege of telling your story for a CBC story that we did, and this was Had you finished chemo when we did the story, because you were back to lifting, you and Mark were lifting, but had you finished chemo then, or?
I don't think so. I think I was in between cycles at that point. Yeah, that was 2017, early 2017. Yeah.
And so it was a real privilege to tell your story, and there was so much positive feedback, and now you've turned that into, like, would it be fair to say, like, another part of your career in terms of, I would say, outreach and I don't know if activism is the right word, but do you want to talk a little bit about that?
Yeah, I'm glad you touched on that. Like, certainly before I was diagnosed, and I failed to mention this in the first part of my story, is I was working at the Saskatchewan Cancer Center. So I was working as an oncology pharmacist, working with people with cancer every day. And how I ended up at the Saskatchewan Cancer Agency is it wasn't any real, like, definite career path I had. I finished my degree and I did a kind of like a clinical master's at a Regina Capel. And then I was just kind of looking for jobs, and I kept asking for a job at the cancer agency, and I'm not sure why. And I kept asking, and eventually they caved and gave me a job. And then when I was diagnosed, I just thought, this is why I ended up here. Like, this is some path that I was supposed to be on. And so now, having gone through treatment myself and being diagnosed, I just feel like I can relate to people so much closer. I know the clinical side of things, but then I also know what it's actually like to walk through the fire. So I just really feel now that cancer and cancer care is a part of me, and it's always going to be. So I definitely consider myself an activist, and I try to advocate for people with cancer all the time. And so I do that through my social media. I do it through things like this to raise awareness, fundraising, research, whatever avenue I can. That's where I go.
And one of the great things that you have started to do are these I guess gatherings called chai and chats. And so right now we are hearing a little bit of a chai and chat, and I was lucky enough to go to your first one. That was way back in February,
so they would come for a visit
when it was cold and dark.
But
it was really interesting, and I'm wondering what do you remember of that first chai and chat?
Warm them up for lunch tomorrow. So that was definitely handy going through it, especially there were some times I was in the hospital for big chunks of time. So I think I spent like 170 days in the hospital in 2014. Like, that was like admitted to the hospital. And then there was like all the blood work days and oncology day center days for blood or whatever. So it was a big.
So did you have?
Definitely, I was definitely nervous. You know, like I started this chai and chat group along with Kim, who you'll hear from next. But she and I really felt like, as young females fighting cancer, there wasn't really a place that we fit in, right? So when you think about cancer, you often will think about, you know, your grandma that had cancer, or someone that's a bit older, maybe their picture's a bit different. They might have adult children, they might have paid off their mortgage, but for women like Kim and I didn't have any children when I was diagnosed. Kim was diagnosed, well, maybe I'll just leave that part of the story to her. So Kim was very young when
That's a very good teaser.
Kim was very young when she was diagnosed as well, and like I was still paying and still am paying off student debt, and you know, we had those financial pressures, and it's just different for someone that's younger. So we started this group for just females, and I say young females, but really young is however you define yourself. If you think you're too young to be diagnosed with cancer, then you're welcome to come. And so I was definitely nervous to see how it would go, but it's really blossomed into something very special.
And one of the great people that I was able to meet, thanks to you, was Kim Switecki, and her story, is fantastic. So I'll sort of set the scene for everybody. I was getting some sound of everybody talking, and then you were kind enough to introduce me to Kim, and so we went off to a different part. We were at, was it Delish that we were at, the coffee shop?
Yes, yeah.
Great coffee shop here in Saskatoon. And so Kim and I went and sort of did our own conversation, and she's a really, really wonderful person. So we're off at this table to a side, and you guys kept talking, and then I started by asking Kim sort of to set the scene for us in terms of what was happening at Delish that night.
we are having our first ever Survive Her Chai Chat. So we're getting together local survivors and fighters of cancer, females around the city or around Saskatoon, just to start building a network of female fighters and just to support each other through this incredible journey that nobody really wants to have, but sometimes those connections are what get you through a very difficult time.
Why did you want to start this?
I wanted to start because when I was going through my cancer journey 5 years ago, I felt almost lost. As you're sitting in waiting rooms, especially as a young female cancer fighter, you look around and you can't necessarily really relate to a lot of other people. They're generally a lot older, especially my type of cancer was non-Hodgkin's lymphoma, so there are a lot of senior patients. So looking around and trying to relate to somebody or find that same page of somebody that, you know, is going to be a new mom or is a new mom or early in their life and trying to figure out the next steps. There wasn't really anything around that I could find that had that in it. So just trying to build that for other women and going forward for us as individuals to help each other and help ourselves, I guess.
You sort of touched on it a bit there, but why is something like tonight, because around the table there's like 7 or 8 people, and you're sharing stories about what you've been through or perhaps what you're going through right now. Like, why is that important for women that have either had cancer or going through it right now?
I think a lot of it is like when you have a cancer diagnosis, you're just thrown into a whole new world that you never expected that you would ever have to go through, especially for young women that are sort of at their prime. They're starting their jobs, they're moms, they're figuring out life and relationships, and then all of a sudden you're thrown down this loophole where it's like, actually, we're going to sidetrack you way over here and try to, you can find your way back. So having these connections and even taking the fear out of some of those experiences and just, I know a lot of the time, some of the procedures I had to go through is big and scary because I didn't know anything about it and I didn't know anybody that had gone through it. But talking with people and seeing that people had, gone through it and it wasn't that scary and getting their experiences was huge, to bring down my emotion, my mental state, and just feel a little more comfortable going through it. And it's just nice to sit around at a table and just be like, you get this.
Can you remember a time when you were going through, maybe it was first of all with the diagnosis, or maybe during the treatments, where you wish you would have had someone just to bounce ideas off of, or bounce just what you're going through, or had questions? Do you remember a specific time that stands out?
I don't know. I know partway through the journey, we had gotten so much help at the cancer center and the oncology ward. My husband and I would be sitting there talking. It's if we make it out to the other side, we want to do something to give back to the community and to grow this in some way. And we've dabbled with ideas, but never really executed on anything, I guess. And then a few years ago, I was invited to talk at Shock Liqueur, which is an organization in Saskatoon which raises money for the Saskatoon Cancer Center. So after I spoke there, I asked to join, and they were very humble and were all on board on me joining the organization and the committee. And then Amy was a speaker a few years later. So she's been on for a couple years, and we've just gotten to know each other for a couple times, or through Shock Liqueur and the events. They have fashion shows and galas to raise money for the Cancer Center in Saskatoon, and now the Cancer Foundation of Saskatchewan. And then she has her Survivor book that she had come up with in the concept, and then she put it out there being let's make this bigger. And I was just yes, let's make this bigger. I want to do this. And I have all these ideas that let's get women together and let's get people together and form a coalition so we can support each other. And delve into like some of these big subjects, or just even if you just need to go talk with somebody, even if it's not cancer related, but just have that understanding that like today is a bad day, like, and you get me because you've been there, and I know, like I could talk to my husband about this, like it's a bad day, but he might not really quite get why, right? As much as he tries to understand and get where I'm coming from, and he's seen me through it, some days even post-treatment, it's like, this is just like, it's not a good day for whatever reason, and to have somebody around that just gets it because they've been there and they've been through that experience, sometimes it's just comforting in itself.
You're a really good talker. Thank you. You mentioned some of the bigger subjects. What are because I know tonight's like the first one, but what would be some of those big subjects that you would want to like hopefully get brought up, naturally in a conversation?
Sometimes I think some big ones that people might either avoid or be scared of talking about might be something like anxiety or depression going through it. I know going through my experience, I pushed it off to the side a lot. Doctors had mentioned like this is my brain fog. After you have a baby, but you get depression. Postpartum, yes. I'm like, it's not post-traumatic. Postpartum. They'd mentioned possibly that a couple times, and I was always pushing it off because I'm like, no, like there's all this other stuff going on. That's why it's going on. But then about 4 or 5 months down the road, it was like, okay, yeah, like, no, I need help. But like, it took me 4 or 5 months of people like telling me, like bringing it up a bit to actually recognize and be okay with like dealing with. So just, I guess the anxiety, depression side of things, where because your life has done a huge shift from what your regular was to this other path that life is now taking you on, can be quite traumatic, and dealing with that can be very difficult. So finding the right realms and being okay with that. For lots of women, it's fertility issues too that come up. A lot of the treatments will either affect their fertility, or it might completely eradicate their fertility. And for lots of women that are in their 20s to 30s going through this, hopes of families or hopes of having kids, like that could be crushing those dreams, in the sense that they've always thought of. There's definitely other methods that might be able to grow your family, but it might not be the way that you always imagined it. So those sorts of ideas that are big that we can relate to each other with, I hope we're able to help people with. And even if it's not like at a monthly meeting where we just talk cancer, we just want this like build a network so that people feel comfortable and they make some connections, and they might make that connection that, yeah, like I'm just going to text my friend that I met at Chai and Chat and say like, hey, I'm having a rough day, like want to go for coffee. And even if they just find their own way to connect and talk and network that way, like I think that's what we're really trying to get at too, is just making connections and having people feel safe and comfortable reaching out to other people in our community.
This is really important to you, isn't it?
Yeah, I think so. Yeah, it feels like I'm maybe having an impact. Hopefully helping somebody go through something that nobody wants to go through, but maybe in a way that will brighten their day a little bit going through it. Yeah.
Want to ask you too about in terms of other resources in the city. Are there things that sort of stand out in terms of like, yeah, like we're doing this well in Saskatoon, or are there gaps where you would like to see more support? And I'm guessing that perhaps this is filling one, like what you're doing tonight. But anything you want to say about that?
I know there are several places around the city that do yoga classes for cancer patients that are really good, and they're really good at building their groups and connecting with the people within them. There's the traditional support groups that, like through the cancer agency and things like that. But yeah, other than that, I never found that thing that brought lots of people together. Amy was really good when she came to Chocolate Care. She's being bringing the Cancer Couture set to their fashion show, which I think is really good because it female cancer survivors and fighters can apply to model in the in the fashion show at Dutch Growers, and just building those groups, right? Like bringing those female cancer survivors and fighters together for that show, but getting them to do something where it's like, it's exciting, it's fun, they can bring their family out, it's something different. And I think like when you see it, it's just like everybody gets goosebumps, and like the round of applause that the ladies get when they're done walking the show, like it's just like it gives me goosebumps just talking about it right now, thinking about it, and seeing, like, I've had friends walk in it and just like seeing how empowering it is for them. One of my friends, like, it's the first time she was out in public without any hair, so like, but just rocked it on the runway, and like
Empowering.
hugely empowering. And just for people to see that as well, that, you know, like these women, when you're fighting cancer, you don't necessarily have to be just, you know, like holed up at home. Like, you can still do these other things, and you can still be powerful, and you're still a woman, and you're still beautiful. And just bring those groups together, because now those groups, like, they know each other. They had that fun night out, and now Amy, like, they have their groups on Facebook, and like they still chat with each other. And I think one of our members here tonight is one of the first Cancer Couture models, so she's in one of the first shows, and you know, like things like that, and making those connections, I think. But just, I think we're just trying to make more of those happen. So, yeah.
Last question for you. How will you know if what you're doing tonight with Chai and Chat, how will you know if it's a success in your mind?
That's a good question. I guess if we keep having, you know, like these get-togethers, and we keep seeing new faces, and you know, like if we're asking, like, how did you hear about us at these connections? And it's like, oh, well, I heard from this person, or from this person that has been in the group too, that the word is getting out there, and that they're talking to each other, and it might be a friend of a friend, or even if it's like, oh, you know, my friend told me about this group, can I come? I think those are going to be the important ones, where we're getting people that might not have necessarily known about it first, but they've heard about us through the grapevine. And yeah, I guess growing the connections and seeing the group get bigger, maybe having to find a bigger space than 10-person table, but I'm really happy with the turnout tonight. This is sort of a test to see how it would go, and hopefully have bigger, more events and more get-togethers. And we've got a few fun ideas planned for different types of get-togethers, so it won't always be coming and sitting and having coffee and a chat. It could be like going paddleboarding, or doing a book club, or just different things that we can connect with, but not necessarily only talk about cancer. I think is the big part too, is that we're connecting on all parts of life, but we also have that connection if we need to chat about that side. To inspire us, like they had different people's pictures, and they'd asked me to be one of them. So my picture was there, and after, my son's like, why were you on this, like, why did it say, like, you inspire us and things like that? And there's another section that was we remember, so we talked about the differences of it, and he knows I've had cancer because he sees pictures of us when he was a baby. He's like, why don't you have hair when I was a kid? Or like, when I was a baby, what happened to your hair? So very generically, on one of his vaccination days, one of the nurses was like, oh, like, I'm putting soldiers in your body to help you fight germs. So it's just sort of like, well, like, I had a big germ in my body called cancer, and like sort of explained that. He's like, oh, and now you won, Mom. Your soldiers won the battle. And he's like, you can choose where to go for supper because your soldiers won the battle.
That's so
sweet. But now we go
I really
up,
appreciated
every year
how
we go
honest
up to war.
Kim was in the
We were
conversation,
there,
especially
and
when
they were
she
like,
discussed
"This is second
how
family
she
for
was
us."
going through her cancer experiences 5 years ago.
like
She
those
didn't have a lot of
Asian
people
friends.
to
Yeah,
talk with,
everywhere.
which
Yeah,
makes,
the Uncle
I
George.
think, Amy, these chine chats that you two are doing so important.
Yeah, Kim is wonderful, isn't she? And she's such a testament to what people with cancer are all about. And I think you'll realize that when you listen to the different interviews in these podcasts, but also the people that work with people with cancer, is that these people, they just like continue on, right? And Kim talks about her story just, not really nonchalantly, but like that this is what happened and this is what she did to overcome it. And it's incredible.
Yeah, and she was, I think she said 24 weeks pregnant when she was first, like I can't imagine that. Like that's...
Yeah, like you're already 24 weeks pregnant with your first child. It's already a very bizarre time anyways. You're not really sure what your body's doing. And now let's just throw cancer into the mix.
Yeah. So I'm very happy that your chine chats are going well. You guys just did one last week, right?
Yeah, last week we were at 220 and we did a vision board workshop with Lana Price, right, who's a life coach. And so we were working on bucket lists and how to achieve these goals. It was a really lovely evening.
You are listening to part 1 of episode 12 of YXC Underground. I'm Eric Anderson, and I'm joined by Amy Smith-Morris. Subscribe to the podcast on Apple Podcasts or your favorite podcast app, and you can find all episodes on yxcunderground.com. We are talking about cancer in this episode and speaking with people from Saskatoon who are helping others who are undergoing cancer treatments or need help post-treatment. We're in Amy's backyard. It's a beautiful Friday afternoon, and I wanted to ask you, Amy, about how you were feeling kind of during and after your treatments, but especially when it comes to food.
So I think we have this in common, is that we both love good food.
We both love good food, yes.
So I was a very well-fed child growing up, surrounded by very lean sisters. So that was difficult, but I love food and I love eating and I love the social aspects of it and I love trying new things. So when I went through treatment, that was challenging for me, definitely, because food tastes different and you're just kind of struggling to find out what you can tolerate. Like what would you actually eat if it was put in front of you?
So can you give me an example of a food that tasted different? Because I have a hard time wrapping my head around that.
Yeah, let's go like very basic.
Okay.
Like water tastes different. Water can taste like kind of just like metallic-y almost, or it just doesn't taste the same because water tastes like nothing, right? So it's bizarre. So to kind of get around that, I was doing, maybe putting like Mio or flavoring into water to stay hydrated, or maybe previously I was avoiding certain foods because I didn't really like them, and now I was eating them all the time during treatment because it's really all I could tolerate.
Wow.
I know I remember during treatment, I lived with a lady in the city, so I lift weights with a lady in the city, and she would go to Costco, and they have these melons, and I don't even know what kind of melons they are. It's probably like a hybrid, and she would just bring me like melons every time she went to Costco, and I was like, Sandy, bring me more melons.
Because they just appeal to you.
Yeah, that was just it. Those just tasted good at that time.
I found this fascinating because I wanted to learn more about the relationship with food and when a person is undergoing cancer treatments and post, because where I work at Sherbrooke, we're doing a lot of education and learning a lot more in terms of the research about relation to diet and for people who have dementia or early onset dementia and that relationship. And I just find that fascinating. So I wanted to learn more, and so I reached out to the Saskatoon Cancer Center and Saskatchewan Cancer Center, and they put me in touch with a woman named Jennifer Fisher, and Jennifer is a registered dietitian at the Saskatoon Cancer Center, and when she talked about different, like food tastes different, and so her example, and you're about to hear it in the interview, relates to tuna sandwiches. I don't know if you're a fan of tuna sandwiches.
I can't even imagine.
I'm not a huge tuna sandwich person myself, but
Yeah.
I thought it was a really great example because people that love tuna sandwiches really love tuna sandwiches.
Like a very distinct taste too, right?
Yeah. And so if it tastes different, then how's that feel? So, I met Jennifer at the Saskatoon Cancer Center, and we started our conversation with what a typical day might be for her.
Yeah, it's true that there isn't a very typical day around here, but the dietitians see all types of patients. So we see people when they're here receiving their chemotherapy, when they're here for their radiation treatments, just seeing doctors. And just to help out so that people don't have to come for extra appointments, we try to see them when they're here already. Just to make it a little easier, parking is not always easy around here, so just to limit the number of trips. And what we dietitians do here, we basically help patients with any nutrition-related questions or concerns that they have before, during, or after their treatments. Much of our role is just to help them manage those symptoms that are keeping them from eating.
So what would those symptoms be?
So generally just a lack of appetite. People just might not feel like eating, nausea. People will say, you know what, food just doesn't taste the way it used to. A tuna sandwich doesn't taste like a tuna sandwich anymore. Or just trouble regulating their bowels, things like that. Just anything that pertains to food going in and any problems that they might have, helping with weight loss, just anything that comes up.
So when someone comes in and says, Jennifer, my tuna sandwich doesn't taste like a tuna sandwich anymore, how do you respond to that? And then how do you work to maybe help them, discover new tuna sandwiches or something like that? How does that work?
So it can be a side effect of the chemotherapy or radiation, depending on where you're being radiated, but it can be a tricky side effect to deal with. It's actually one of the hardest ones because there isn't an easy answer. If people are feeling nauseated, we give them a pill and they feel better. There isn't a way to really make the food taste the way it should again. So it's about adding different things and trying to trick your brain into thinking that you like the food. So going back to the tuna sandwich, for example, usually pickles fix everything. Or using a lot of mayonnaise to make things more slick and just easier to get down so you don't have to chew it quite so much. So if it doesn't taste good, you don't want it in your mouth for a very long time. So just little tips like that. Is it
hard for people when, because I love food. I love good food, and if some of my favorite foods didn't, like if a cheeseburger didn't taste the same, that would upset me. So do you have to, is there a certain sense of, or a certain part of counseling that you almost have to do too with your job?
Yeah, definitely. Food it's a very social aspect, and we eat to enjoy it, right? And when that's difficult to do, a lot of it is being almost like a cheerleader, just you can do it, it's temporary. If we can get you through these treatments, food will taste good again. And sometimes it's about not eating your favorite foods during treatment, because if they don't taste the way they should, they won't be your favorite foods very long. So just trying to find different alternatives that people might enjoy to get them through the treatment, and then they can hopefully enjoy their foods a little later.
Do you find that people are open to your suggestions for other foods?
Oh yeah, definitely. If people, just because eating is so important, and if it's not going well, they're like, what can I eat? And help me, I will take any suggestion. Let's just make this easier.
So I'm just thinking back to my cheeseburger example. Maybe that wasn't the best example, but when people are undergoing treatments, do you recommend, Jennifer, that people should be eating maybe healthier foods, or how important a role, I guess, does diet play when you're undergoing treatments for cancer?
Well, I may be biased, but I think diet is very important. Diet can play an important part for people receiving these cancer treatments. It's estimated that up to 80% of people diagnosed with cancer and going through treatments struggle with something called malnutrition. So it's basically just not getting the nutrients that you need. And so just having the right type of diet can help people just feel stronger, get through the treatments a little easier, not too many delays, and just, yeah, having a shorter recovery time. Just, it generally goes a lot better if we can get people eating.
With the recovery time, tell me about that. Like how important does eating the right food pay off in the end?
Yeah, so if people are losing weight during treatment and just having a hard time, it's, of course, it's not all diet, but if the better people do during treatment, usually the faster and easier their recovery time.
What made you want to get into this line of work?
Well, my previous position, I worked in a hospital, and so I really enjoyed the clinical work, but I kind of missed the part of long-term follow-up with people because they're in the hospital. I would see them, they get discharged, and I would never really know what's going on. So when this position opened up, I applied because I thought it would be just that nice mix of the clinical work plus just being able to follow people for a long time, through their cancer treatments, and just see how it goes and see if I can help them. I've had some people close to me diagnosed with cancer, so just I guess that always made an impression on me, and just seeing how tough it can be just helped guide me into this world of oncology.
You mentioned the relationships and how you get to see people when they first come here to the cancer center, and then throughout their journey. What is that experience like for you when you see maybe someone come in, on day one, and I guess depending on the treatments, like it can be a long-lasting relationship, I'm guessing?
Oh yeah, I've had people that I've seen for years, and it's good friends. We're asking about each other's pets, and we're asking about the kids and the grandkids, and just building that rapport and building a connection with people, because it's also important to remember that people are more than their cancer diagnosis, right? Because they come here, and it's of course they're here because they have cancer, but that's not all they are. So just making those connections and just helping bring back a little bit of the humanity to the conversation as well.
That's a really nice way to put it. And you're not the first person for this podcast that has said that someone is more than just the cancer diagnosis. But is that hard sometimes, because it becomes, from what I've learned anyways, it becomes so all-encompassing. But is it hard to kind of separate the two?
It can be. When you're in the treatments and if you're not feeling well, it's impossible sometimes to just, for people to pick themselves up and get through their normal activities, just even, dusting or going for groceries, it's so much harder. So just to get people feeling better and remember, there's this cancer part, but there's also this other part that we need to keep healthy and strong. And we also have social workers here that really help with the psychological, mental aspects of things as well. So just whatever the patient needs, hopefully we can get them through.
Do you enjoy being part of a team like this here at the center?
Oh, definitely. Yes, we take a very kind of multidisciplinary approach here. So that's one of the things I love about this job is the doctors, the nurses, there's social workers, pharmacy, the radiation technicians, and everyone else that I'm forgetting right now. But it's starting to feel like an Oscar speech now. But just we all get together, and it's a very amiable group, and we just all do our little piece of what we can to make sure that the person is getting kind of the best care that they need in their individual situation.
I want to ask one more specific question about your role. And you mentioned kind of the long-term relationship that you have with people. And when you see them leave, and say, for example, it's everything's turned out well and it's a clean bill of health, do you, as a role as a dietitian, do you give that person sort of guidelines or in terms of like diet suggestions to keep their health up? Or do you just say, have as many tuna sandwiches as you want or cheeseburgers as you want? I'm guessing maybe not, but.
Well, a little bit of it depends on how they did during the treatment. If people are just feeling well and they're ready to get back into their old ways, just it's great that people feel that they can do that. For some people, if the treatments were a little tougher on them, I usually recommend that they just kind of stay on whatever diet I prescribed for them until they're feeling a little bit better. And that it can take, months or even a year or two, just depending on what happens. So just getting back into the normal swing of things is good, but just recognizing that sometimes it might take a little bit longer.
What do you love most about your job?
The people, of course. It's the patients. Just when they're receiving their cancer treatments and they come here and it's just this scary world of unknowns that they're entering, and just seeing how strong and resilient people are, and just the attitudes coming in, and just seeing all of the support that they get from family and friends and communities, it's just really, really inspiring to see.
Thank you for your time today. I know when we were talking beforehand, you were slightly nervous about this, but I think you did a fantastic job. So Jennifer, thank you.
Thank you. Thank you very much for coming.
I will never take for granted the taste of a cheeseburger. Again, I can't imagine, Amy, a cheeseburger not tasting like a cheeseburger. And like that would legitimately upset me. And I can't imagine what it was like for you. The fact that water tasted different, or the fact that you have now a sudden craving for these melons at Costco. Like, that must be so weird.
Yeah, I know, isn't it strange? It's really bizarre, but I think like really my love for food actually helped me through treatment, because I didn't lose weight during treatment. I know Jennifer talks a lot about how lots of 80%, I think she says, of people with cancer struggle with being malnourished, and I think my love of food really carried me through it. So I didn't gain weight, and I kind of figured I wouldn't didn't lose weight, and I kind of figured I wouldn't lose weight. So that all worked out anyways.
I'm wondering though, like, when you were undergoing chemo treatments, was there, like, did your appetite, did it go away, or was it still there?
Definitely, it had ups and downs, right? So I had chemo every 3 weeks is how my therapy went. So immediately after chemo, it definitely took a hit, but then it would perk back up, so I could eat quite a bit to prepare for the next cycle.
I feel like we could have a separate podcast just talking about food and our favorite places to eat in Saskatoon. But
YXE underground food.
Yes.
Yeah.
That would be kind of fun. That'd be lots of fun. This is part 1 of episode 12 of YXE Underground. I'm Eric Anderson, and I'm joined by cancer survivor and the pride. Can I say the pride of Abby, Saskatchewan?
God, I don't know if that's true.
Well, I should say too. So your family grew up with my wife's family, and so can I say pride of Abby, Saskatchewan, or is it more Lancer or Port Reeve or
Abby? Right? It's wherever you get your mail. Yeah, Abby.
Amy Smith Morris. And you can subscribe to this podcast by finding it. You can find it on Apple Podcasts, Google Podcasts, or your favorite podcast app. And you can also stream episodes on Spotify and on the website at yxeunderground.com. And Amy, I want to ask you, where can people find your website? Because it's a great website.
Oh, thanks. So you can find me at amydfarmd.com. So it's AMYDEE. farmd.com. And I have a blog up there, and that's quite active. My goal for this year was to blog for 52 weeks straight. So there's content every week for the next 52 weeks.
How is that going?
You know what? I started in November, so it wasn't really a New Year's resolution, and it's going pretty strong so far. Yeah.
That's good, because I find just with this podcast, the social media requirements and sort of, it's a lot of work.
It is. There's no doubt about that. It's a ton of work. But I think I really like writing, and because I'm on maternity leave now as well, I have a bit of time to do writing in between doing other things. So I thought I'd give it a shot.
You're a very good writer too. So one of the organizations in the province that's having a presence online, on social media, that would be the Cancer Foundation of Saskatchewan. And the CEO of this foundation is a woman named Nora Yates. And I did not know who Nora Yates was, but thankfully for you, Amy, you did know her, and you set us up. And I'm wondering if you could tell me about how you were able to cross paths with Nora.
I think I first learned about the Cancer Foundation of Saskatchewan through the Chocolate Cure Committee in Saskatoon. So this is a board of mainly women that are based in Saskatoon, and they're kind of like this big fundraising force for the Saskatchewan Cancer Agency. And so I sit on that board along with Kim, who you've heard an interview from her. And we were finding out that our fundraising efforts were going to be shifted from the Saskatchewan Cancer Agency to this new foundation that was going to be started. And so I'd first heard about the foundation then, and then being so involved in cancer care and advocacy work in Saskatchewan, I just thought, oh, I have to meet this person. This would be interesting. So I reached out, and Nora is lovely and gave me an opportunity just to have coffee with her.
She is really, really interesting, and you'll hear it in the interview, but her fundraising career is so extensive with various organizations, and I find the art of fundraising to be fascinating, because I am not comfortable asking for money at all, except maybe if it's my parents. But yet this is her job, and it's an important job. So it's very interesting. Nora is a hard person to track down. So this interview probably took a couple months of figuring out where she was going to be, but we both thought it was important to speak with her because the work that the foundation does really has an impact here in Saskatoon, doesn't it?
Yeah, and talk about underground, right? This foundation is brand new.
Yes.
So something lots of people haven't heard about before.
Yeah. So I actually tracked down Nora in Regina, and there's nothing wrong with doing an interview in Regina. But Saskatoon's better. But anyways, I went to Regina.
Lost a bunch of listeners, maybe too.
No, I lived in Regina for 6 years. It's a great city. So we actually met for coffee at a place called the Naked Bean, which is right across from the CBC in Regina. And Nora's awesome. And so we met in Regina, and I learned so much from her. And so the first, I guess the first thing I wanted to ask, if I could just flip this paper here. There we go. So, like we said, she is the CEO of the Cancer Foundation of Saskatchewan. And yes, we started by asking how she would describe the foundation.
Oh my goodness, that's a big question with a big answer. So the Cancer Foundation of Saskatchewan received charitable status. We are a charity, received charitable status in May of 2018. And as of January 2019, this year, we became the official charitable receiving body for the Saskatchewan Cancer Agency. So if you want to know who the foundation is, we're the fundraising partner of the Saskatchewan Cancer Agency. So to understand that, you need to know who the agency is, because that really is the crux of who we support and why we're here. So the Saskatchewan Cancer Agency is the governing body parallel to the Saskatchewan Health Authority, where the Saskatchewan Health Authority looks after healthcare. The Saskatchewan Cancer Agency looks after cancer care and cancer control in this province. So the Saskatchewan Cancer Agency operates the 2 cancer clinics, the Saskatoon Cancer Centre, the Alan Blair Cancer Centre in Regina, the patient lodges where cancer patients can stay overnight when they're in for treatment at a great cost, and I can get into that a little bit later on. They also run the screening programs. They do research out of the University of Saskatchewan. There's so much. So we as a foundation are going to support the work of the Cancer Agency.
I didn't realize there was so much there, and we can get into that for sure. Why was now the right time, and I guess now in terms of the last year or so, but why now to have this foundation?
Great question. So why now? Now is the time. And the time is now because in Saskatchewan, people are actually giving directly to the Saskatoon Cancer Centre, directly to the Alan Blair, directly to the Saskatchewan Cancer Agency because they want to make a difference. And the rationale for putting a foundation in place is to be able to take those donations and actually proactively talk to donors about what the needs are of the agency. Because when people gave to the agency, their privacy policy, as you can imagine, the agency deals with patients. Privacy is utmost to them in terms of client confidentiality, patient confidentiality. So they were never reaching out asking for money. People are giving, they're getting their charitable tax receipt. And the agency and their board of directors realized if they had a concerted effort to fundraise, they could actually raise more money for needs of the agency. And looking east and west, Manitoba has had a cancer foundation for 20 years, Alberta for 30 years, and British Columbia for more than 50. And they've seen it done successfully, and they did a feasibility study here in Saskatchewan, and there was resounding support, and they said, let's do it. We are not fundraisers. We, the agency, we are not fundraisers. We look after the patient. Let's put a foundation in place to look after the donors.
Why is doing this proactively? Why is that so important as opposed to just focusing on the work and then, I guess, waiting for the donations to come to you?
Because if you can be proactive, you can address what the need is. So we can say, we need funds for this. If you don't tell people what you need and why you need it and ask for funds, you will get funds coming in the door that might be designated to something that the agency is not currently working on, and that money's going to sit there. So you could have funds designated to a specific type of cancer or cancer research that the agency's not currently working on, so the funds sit there. Donors' dollars are not used. And this way, if you go out and say, look, we need this. People want to make a difference. When they're giving, they want their money to be used. So if we can go out proactively and say, we're fundraising for this, 9 times out of 10, people are going to give to that. But if they don't know about it, they're just going to give to something else.
I find your job fascinating because, and I was telling you this when we sat down before we started the interview, I suck at asking people for money. I just find it really, really difficult to do. And yet, that is your job, and you have a wealth of experience doing it. So, if I were a donor and I want to donate to the foundation, how would that conversation go?
That conversation would take place over several months because giving is about relationship building. And if you do it right, you don't have to ask. If I talk to you, Eric, about who the foundation is and what we do and the people we serve and what those needs are, you'll offer me money.
Really?
Yeah.
And it's not just one conversation, it's over
It's many conversations. First, we have to, and especially being new, so we're a new foundation, we have to create awareness. So we're out there creating awareness, letting people know who we are, why we're here, and the gap that we are filling in this province. And then we talk about what some of those needs are and what interests you. And you might have an area, you might have an interest in screening or prevention, or you might have an interest in research, or you might have, and you might not even know. You've maybe been touched by cancer and you think, oh, I want to give back to cancer. Well, what area? Oh, I don't know. So it takes time to figure out where your passion is, and then that's where we tap into to make sure that when you give money, it's going to go to an area that you're passionate about, so you feel good about that gift, and then you're going to give again.
So at what point in the relationship do you make the ask or make the tell, or does that happen, or do they? Yeah.
Yeah, so you do. I can sit here and say we have to ask, and sometimes I don't have to ask. But if you do have to at some point, whether it's a direct ask or it's a inconspicuous kind of under the table ask, they don't really know they're being asked, but you are asking. You can physically ask. I can verbally say, you know what, Eric, I would like you to step up and provide a gift of $5,000. And you'll say, oh, Nora, that's too much. Eric, what if I said to you, could you give me $5,000 over 5 years? Could you do $1,000 a year? That might be a better fit for you. When I go to bigger corporations or individuals who have a reputation for being philanthropic, then I do ask them what their comfort level is. And I can say, I'll get back to you with a proposal, and I'll put it in writing, and I'll maybe give 3 options, and then they can choose. But you can't just go out for coffee and have coffee and not talk about and not talk about the charity. You have to talk about it. You have to have the conversation. Just meeting for coffee once every month at the end of the year, you could actually have nothing except a lot of coffee bills.
So in your new role then with this organization, how has the I was going to say the art, but I guess the act of building those relationships, because cancer has touched so many people in this province. Have you found those relationships, have they been easy to build?
I think, I wouldn't say relationships are easy, but I wouldn't say they're hard either. And one thing I'd like to say is that, yes, 1 in 2 people in Canada will get cancer in their lifetime. So the 2 of us sitting here, which one of us should get cancer, right? That's a tough question to answer. But just because you've been touched by cancer doesn't mean actually that that's where your philanthropic dollars are going to go. And there is an assumption that everybody's been touched by cancer. It must be so easy to get money. And you know what? I know plenty of people touched by cancer whose passion is the lunch programs in the city, or the literacy, or something else. It doesn't define, cancer does not define who you are or determine where your philanthropic dollars are going to go. So that relationship, for me, being in the role of the CEO of the Cancer Foundation, because I've been in fundraising for 15 years, I'm fairly comfortable calling here in Regina, saying who I am, and they'll say, oh sure, come over, let's have a conversation. The bigger challenge is this is a big province, and we don't know where the interest is, and you only know about it by reaching out through marketing, communications, and one-to-one phone calls. Yeah.
I'm so glad you brought that up, though, in terms of it is an assumption, and I had that assumption in my head in terms of this might be easier as opposed to another cause or something like that. But you're right; it doesn't determine who you are and where you want your money spent.
That's right, and I think it's the same. I think people would agree with me, and without putting words in anybody's mouth, but these causes are so important. And I think the important thing is that donors are given the option of where to give and to know where their dollars are going to be used. And that's another reason for the foundation being in place, because we will report back. We will create a donor report, which hasn't been done before, right? We will create a newsletter, and we will be able to report back on where your donations are spent, how they're making a difference, and who they're impacting.
Are there specific needs right now that you as a foundation are asking for, and I guess what would they be? Okay,
so things that we're asking for now are research dollars. I mean, we have 4 researchers in Saskatoon, so absolutely research dollars. The thing that I see the greatest need for as somebody new to the foundation and learning more and more about the agency is the items that touch the patient care and comfort. So those items include, as you can imagine, we are a huge province. We've lost our transit system. Gas prices are astronomical, and I don't think that's going to change anytime soon. And patients who have to travel in for treatment from rural Saskatchewan can't afford it. So what can we do? So we as a foundation can fundraise for gift cards to help with mileage, to help with gas, to help with food. If you think of rural Saskatchewan, which is a big part of our province, a couple who are farming and one gets cancer and has to come into Saskatoon or Regina for radiation treatment for 5 days a week, 4 to 5 weeks at a time, the cost alone, let alone being off the farm and the loss of income and the challenge for the partner that's left there, perhaps with family. So we raise funds for those gas cards, the grocery cards. There are needs for wigs. Some people need a wig. People who have head and neck cancers, there is a certain type of x-ray they need, dental x-ray, that's not covered under their benefit plan, and so we'll fundraise to help get that first exam done for them. There are, blanket warmers, warm blankets, the new more comfortable chemotherapy chairs, comfortable chairs in the waiting rooms, the nutrition cart. Oh my goodness, Eric, can I tell you about the nutrition cart?
Please do.
Okay, so in both of the cancer centers, there is a group of volunteers, and this is run solely by volunteers, except the person who organizes them all. They come in Monday to Friday, and they grab the nutrition cart that's stocked with coffee and crackers and some juice maybe, water, a few odds and ends, and they will push that nutrition cart through the cancer center all day, offering it to people who are there waiting for hours at a time because chemotherapy takes a long time, appointments, they're in for checkups, they maybe have a family member with them, and those nutrition carts, one of the things I asked the VP that oversees patient care is, what do you, if you had all the money in the world, what do you need? What would you like to offer? They'd like to offer hot chocolate. Well, why don't you? Because it costs too much. Because not everybody drinks coffee. So imagine in the winter, you're in there, you don't drink coffee, maybe you'd like a hot chocolate, or you have a child with you who would have a hot chocolate. Those nutrition carts, so $10,000 for 1 year will fund all those items on a nutrition cart. Ginger ale, right? Things like that.
This is fascinating because I thought you were going to say like bigger things, or like, quote unquote, like sexier things, like the, machines and devices that will help, find and diagnose things. But these are, like, you're talking about gas cards and hot chocolate for like all these little things. Like when you explain this to donors, what is their reaction?
They're shocked, first of all.
Like I am.
Yeah, exactly. But I think, what the thing you have to think about is, this is one of the toughest times in your life. When you're diagnosed with cancer and you don't know what the outcome's going to be, you don't know how you're going to react to treatment, you have no idea how it's going to impact your health, your mental health, your physical health, your family, your friends, your community. When we say cancer touches everybody, it does. It doesn't just hit one person, it affects everybody that's within their circle. And if we can do something to make that journey a little bit easier, so you're sitting there day after day for chemotherapy with your loved one and walk by and say, here's a Tim Hortons gift card, $10, go get yourself a coffee. Go downstairs to the cafeteria and get yourself a bite to eat, right? It's those small things that go, hey, somebody cares, right? Somebody cares. And when we can say donors care, the people in this province care about the people in this province getting treatment, that gives people a mental lift, right? And I think it is so important. And you know what, Eric, I will say there are equipment needs, and I'll gladly talk about that too. But when you say, what are you doing immediately? From the time I've started, this is kind of what we're looking at immediately.
Why is this important to you?
Charity is important to me. People are important to me, and this is important to me because I have worked in the charitable sector for 15 years, and I started my journey in cancer, and it's like coming full circle for me because I'm back, and I'm actually now in a role doing something that I've always wanted to do, which is raise money that's going to stay here in this province to support my family, my friends, my community, my neighbors. And should cancer, one in two, should cancer be the disease that strikes my family, I want the resources there to give us the best possible chance of a cure. And whether that be research or technology or new equipment or medication, I just believe strongly that we as a community, and when I say community, I mean Saskatchewan, should all do our part in making sure we take care of not only ourselves, but our friends and our neighbors.
That was really nice. Last question for you. Where do you see the foundation going in the next year? I know it's pretty new, but just from following, the Facebook page and Instagram and all the social media stuff, like, you've been busy, and so I'm wondering where you like to see the organization in the next year. What are some of the goals?
So some of our goals in the next year, we have to continue to build awareness because people don't know we're here, and people don't know that we're actually filling a gap. Every dollar you give to the foundation stays in Saskatchewan to support the cancer care and treatment for people here in Saskatchewan. That's really important to us. Within the next year, we are going to have a campaign, and we are going to start fundraising for one specific machine in 2 specific locations, and that are the CT simulators. There's one in Regina and there's one in Saskatoon, and they're both in the cancer centers, and you cannot have radiation therapy unless you first have a full body simulation. And the machines that are there right now are at the end of life. There's new technology that we could take advantage of right now, and for us as a foundation, in order to get have the biggest impact we can have, this impacts everybody who undergoes radiation treatment, because you need the images of the body in order to target where the radiation is going to go. I would say one other thing about what are my goals for the Cancer Foundation, and my goal is for when people think about giving to cancer or making an impact or helping their friend and neighbor with cancer, that we're the first foundation, we're the first organization that comes to mind.
Those are big goals. But you were smiling on that last one.
I'm smiling on the last one because I just, it's fun. Like, Eric, this is a serious job, but I enjoy it because I'm out talking to people about making a difference, and when a donor can make the connection between their passion and what their volunteerism or their donor dollars can do to help other people, and you see the light go on in their eyes, it's incredible feeling, and it's selfishly that's what I love, and so I'm selfish in this job as well.
Nora, thank you so much. You're a very busy person, and I know you're going to spend the afternoon with your daughter, so I'll let you go hang out with her. But thank you so much for taking the time.
Thanks, Eric. I've really enjoyed it. I want to thank you for the work you do and for bringing awareness to the Cancer Foundation and to other charities in the community. It's incredible and it's fabulous, so thanks so much.
Nora Yates is the CEO of the Cancer Foundation of Saskatchewan, and if you want to learn more about the foundation or perhaps want to donate, just visit cancerfoundationsask.ca. It's a really great website, and you can learn lots about the foundation and how it's impacting people all across the province, not only in Saskatoon. And Amy, I'm wondering, how do you think this foundation is going to help people?
I often get asked by people where they can donate money to, like to help with either cancer research or people going through cancer treatment. I get asked that question pretty regularly, and often people in Saskatchewan or in Saskatoon want their money to stay local. And so if you want your money to stay local in Saskatchewan and in Saskatoon, this is a place for you.
I found it really interesting to when I asked her the question about what are you fundraising for, and I was picturing these big machines or big research projects, and yet she says little things like a Tim's card or things for transportation because we don't have STC anymore. Like, all those little things really make a difference, don't they?
And I totally agree with that. And you see that with people who are fighting cancer too. Like, they're not difficult to please, right? They really appreciate these small things, right? Like a cup of coffee, like a gas card to get to their appointments, like a volunteer driver. Like, those things, they really appreciate it. So it's not hard to make a difference.
You know what else I appreciate? All your work on this podcast episode, Amy. So thank you.
I appreciate your work. You work like a dog.
No, this has been lots of fun. And this has been part 1 of episode 12 of YXC Underground. My name's Eric Anderson. Amy Smith-Morris has been just a wonderful co-host and has been the engine behind these episodes. So, Amy, I want to give a big thank you to you.
Thank you.
We have one more episode together, which drops on Thursday, and that's going to feature, I think, one of the most meaningful and heartfelt interviews I've ever been a part of. So you're going to hear a conversation with registered social worker and yoga teacher Colleen McBride and Michael McLaughlin, who's a cancer survivor, and he attributes so much of his physical and especially his mental recovery to Colleen and her yoga practices. You've heard the interview. Do you want to give a little sneak peek?
Oh, it's hard to sum up. I would have to say Colleen was my social worker when I was going through treatment, and she was also my coworker when I was at the cancer agency. And so I have a special place in my heart for Colleen, really, because I think what people don't realize is that you have to heal your body from cancer, but you have to heal your mind, and that's what Colleen's all about.
I'm so excited for people to hear their conversation and to hear your insights too as well in the next episode. So I think people are really going to enjoy the episode. A few quick thank yous before we go. I want to quickly thank Janelle Wallace, who's the podcast photographer. She took some incredible portraits of the people that you heard in this episode, including Amy. Was the photo shoot fun?
Oh, so much fun. She's fabulous.
Yeah, she's wonderful. Big shout out to my cousin Andrew Dixon for creating the original theme music, to the CBC's Corrine Larson and David Hutton for their continued support. To my, it says to, the script says to my wife Fred and our dog Fred. It should be to my wife Jennifer and our dog Fred.
So much love for Fred.
Fred's pretty great. Oh boy. Proofread, Eric, proofread. And Amy, thanks again to you for everything. This has been like months in the making, and I sure appreciate it. So thank you.
I'm so glad you could shine a spotlight on cancer care, so thank you.
So subscribe to the podcast on Apple Podcasts or wherever you find your favorite podcast. And you can also stream and download episodes on the website, yxeunderground.com. And you can also find the podcast on Facebook, Twitter, and Instagram. And I would also like to acknowledge that all of these interviews, as well as our voicing, took place on Treaty 6 territory and the traditional homeland of the Metis. Don't forget, part 2 of episode 12 drops in 2 days, so be sure to check back in. Amy will be here. I will be here, and we hope you are as well. Thanks again to all the guests for sharing their stories in this episode. My name is Eric Anderson, and we'll talk to you in 2 days, Saskatoon.